Hi, welcome everybody. My name is Pooja Khatri. I'm a professor of neurology at University of Cincinnati, and it's my pleasure to interview Professor Ángel Chamorro from University of Barcelona about his exciting trial results from Choice, which were presented at the opening session. Dr. Chamorro.
Hi, Pooja. It's my pleasure to be having this interview with you. As you said, I'm professor of neurology at the University of Barcelona.
Well, thank you for joining me. So tell us the purpose of the Choice trial. What did you set out to do?
Well, the purpose was to improve the clinical efficacy of mechanical thrombectomy in patients that obtain successful reperfusion, but nevertheless they still have suboptimal clinical efficacy. And so the idea was to improve this clinical outcome.
And what was the intervention specifically and the sample size? If you could tell us a little bit about the design to recap.
Yeah, we did a randomized clinical trial, a placebo-controlled study, where we enrolled 121 patients allocated to either Alteplase, intraarterial Alteplase, or placebo. Once the patient in the angiosuit showed to have a successful reperfusion defined as a modified Tiki score 2B or greater.
Great. It's such an important next question in the field, how we improve outcomes in patients who have successful revascularization. And I can imagine that was what you were thinking when you were initiating this trial.
This is exactly truth. There's plenty of data showing that despite a very high reperfusion rate of mechanical thrombectomy, the number of patients who are disability-free, that is with a ranking of 0 to 1, is only 27%. We thought that the main reason for that, it was not only that they had an infarction at the time of reperfusion, but also that the reperfusion of the proximal vessels is not equal to reperfusion in the microcirculation. So the idea was to implement and improve the reperfusion in the capillary.
And I'm curious to know how many of those patients that were enrolled were completely reperfused to the naked eye with Tiki-3 reperfusion?
Approximately 60% of them. They originally, I have to say that the investigators, even some of the investigators, the sites, participating sites, were kind of reluctant to accept the possibility of giving a thrombolytic to a patient with an absolutely normal angiography. So at the very beginning of the trial, before the amendment of that criterion, only patients with TK2B could be admitted. But after few months of the trial and seeing about the total safety of the procedure, we extend the criteria to also include patients with TK3. And from then on, approximately 60% of the total population in the study is patients with a TK3 at baseline.
What an interesting design, truly innovative. Tell us the results.
Well, the results is the primary outcome of the study was to the modified ranking 0 to 1 at day 90, and we expected to have a treatment response of 40% in the control group, and we found an 18.5% absolute effect with confidence intervals between 0.3% and 35% and a p-value of 0.004. That is a highly significant clinical trial.
Congratulations. Are there any limitations that you'd like to highlight for our listeners?
Yeah, the main limitation is that we had to stop early the study for some very unusual reason in clinical trials, and that is that 1 year ahead of the termination of the trial, the drug supplier told us that he could not refurbish the placebo that we had in the study. And the expiration date of the placebo forced us to stop when only 60% of the study population had been enrolled in the trial.
Yes, an early stoppage does always risk showing a larger treatment effect, but nonetheless, very compelling data. So, what are the next steps for you in this line of inquiry, and what do you think we as a field need to think about as the next steps from your study?
Yeah, well, for me personally, the next step is to complete all the analysis of the data, including a nested imaging study that we perform with sophisticated imaging in a group of patients included at one of the study sites with perfusion MRI and with MRI spectroscopy that is giving us a lot of information that unfortunately was missing in the main trial because of the sample size. And the next step, and probably the necessary second step, is to repeat choice in an adequately sized study and to confirm that the benefit of Alteplase intraarterially after successful reperfusion are those shown in choice one, and therefore we could go into the therapeutic guidelines worldwide. This is, I think, the next step we should do.
Well, I think I can speak for the field when I say that we all really look forward to these next steps and congratulate you again for opening the pathway with empiric data regarding this treatment strategy. And so we look forward to your imaging data as well as the next trials that will hopefully address this question and change practice. So thank you very much. Congratulations.
Thank you very much, Pooja, for your questions. Thank you.